Straightway, we are going to the what are the current guidelines for management of influenza. Now we will go according to the guidelines of Government of India and Indian Academy of Pediatrics. All the guidelines say that all individuals seeking consultations for flu-like symptoms should be screened at healthcare facilities, both government and private, or examined by doctor and categorized into A, B, and C in order to prevent and contain outbreak of influenza. The following guidelines for screening, testing, and isolation are to be followed. So, what is category A? Patients with mild fever plus cough and sore throat with or without body ache, headache, diarrhea, vomiting will be categorized as category A. As we know that influenza is a viral infection, it may affect more than one mucosal sites. So we may have a presentation of fever with throat pain and sore throat along with GI affection also like diarrhea and vomiting. They do not require oseltamivir. Category A patients do not require oseltamivir, should be treated for the symptoms with bed rest, plenty of fluids, paracetamol for fever. But the patient should be monitored for their progress and they should be reassessed at 24 to 48 hours by the doctor with close monitoring of the vitals and appearance of any red flags, whether they fall into category B where they will need treatment. So if you are not giving treatment and you are thinking the child falls in category A, you should ask them to follow up next day in OPD to assess their vitals and appearance of any red flags. No testing of patient of H1N1 is required. Most of the time, the disease is not severe enough to warrant antivirals and is self-limiting. Patients should confine themselves at home, avoid mixing up with public and high-risk family members, and usually no laboratory testing is required as such for patients. This is for category A. For category B, in addition to all the signs and symptoms mentioned under category A, if the patient has high-grade fever, severe sore throat, requires home isolation, then he requires home isolation and oseltamivir. In addition to all the signs and symptoms mentioned in category A, individuals having one or more of the following high-risk conditions shall also be treated with oseltamivir. If the children is having mild illness but with predisposing risk factors like we have discussed below, the pregnant women, person ages 65 years or older, or patients having these risk factors like lung disease, heart disease, liver disease, kidney disease, blood disorders, diabetes, neurological disorders, cancer, HIV, AIDS. So they come in a high risk category. And the patients who are on long-term cortisone therapy, those patients should be started with oseltamivir. Laboratory investigations such as rapid influenza diagnostic test or RT-PCR may be required in these cases. Antivirals should be started soon, preferably within 48 hours. These are the guidelines says if you start within 48 hours of the onset of illness, that will give maximum benefit to the patient. Now, category C, in addition to the above signs and symptoms of category A and B, if the patient has one or more of the following like breathlessness, chest pain, drowsiness, fall in blood pressure, sputum mixed with blood, least discoloration of nails, that means hypoxia. The children with influenza such as illness who had severe disease as manifested by the red flag signs like somnolence, high persistence fever, inability to feed well, convulsions, shortness of breath, difficulty in breathing, the worsening of underlying chronic conditions, all these patients should be categorized in category C. They should undergo testing. They should be immediately hospitalized and started with oseltamivir treatment. So these are the categories A, B, and C. So summary of treatment: if your child falls in category A, home isolation, bed rest, plenty of fluids, paracetamol for fever, and you should ask them to follow up after 24 hours next day in OPD to monitor whether their severity is increasing and if there are any red flags coming up. In category B, above plus antivirus, preferably within 48 hours, testing may be done. These are patients category managed on OPD basis. In category C, testing should be immediately. Those patients should be managed on IPD basis. They should be admitted and start with antivirals and other supportive treatments. So these are the, in short, treatment guidelines.